So, could we see lockdown regulations eased? President Cyril Ramaphosa has met with the National Coronavirus Command Council and an announcement is expected soon. While new daily cases over the past week have consistently come in under 10,000, would it be wise, though, to ease restrictions just yet? Vaccinations, of course, are not happening at the rate that government had hoped for as well. Let's unpack this with Co-Chairperson of the Ministerial Advisory Committee, Professor Koleka Mlisana. Prof, thanks for your time again. Always appreciate it. So let's talk about what we're seeing in terms of the numbers. They have been kind of low, under 10,000 for the past couple of weeks. Are we ready for an easing of restrictions?
Good evening, Shahan, and good evening to all the viewers. Thank you for having me. And I must actually say condolences to the Cyril Ramaphosa family. And just coming back to the numbers. So if we're looking at where we are right now, I was just looking at today's numbers. And if we're looking at the last, for the past 7 days, we've actually seen a 24% decline on cases. And we also have seen, even with hospitalization, a 10% decline and actually a 32% decline in deaths. And we have been seeing this, as you were saying, in the past weeks. So there is a definite decline. And in fact, even the reproductive number is below 1 now, which means the transmission is reducing as well. So if you're looking at the provinces as well, I mean, now we know for a fact that Gauteng and Limpopo province, they have actually gone out of the third wave. So they are beyond, the wave, the description. And we should be seeing the same, happening shortly. I think it's northwest. And I think Mpumalanga, if I'm not mistaken. So really, you can see that even with the provinces, there's a definite decline. But there's still Northern Cape and Free State, they're still on a bit high, but on the downward slope. So is KZN, Eastern Cape and Western Cape. So when we look at all of this, it therefore means we could actually look at exploring, reducing the restrictions because the numbers are coming down. And I think obviously that's going to then open up the economy, which is always an issue. And so really, I think almost everybody is confident that actually it is the right time to do that. But there's always going to be a caution, Shahan, that we need to always emphasize in that for as long as we don't have the high numbers of vaccinated individuals, we still really want to make sure that we keep transmission as low as is possible. And that's why even when there's opening up and there is releasing, of some of the restrictions, people are still going to need to make sure that they adhere to the non-pharmaceutical interventions. But otherwise, we are hoping that the president will make that announcement when, he addresses the nation.
Yeah. So let's talk about that a bit more because we don't have a very high pace when it comes to vaccinations, right? So why then should we risk actually lowering restrictions when we know more and more people will be infected? And we're also expecting a fourth wave already in November, December.
Yeah. Well, the thing is, at the end of the day, people do want to make sure that, there's opening up. We increase the level of restrictions when we realize that the infections are high. And so when the infections are low, that actually gives us an opportunity. And for me, I really think this is going to be the time, the window that we need to use to increase the vaccination. But otherwise, we do want to make sure that there's a little bit of opening up so that the economy may improve. People have, we understand that every restriction, every time there are increased restrictions, that has got a negative impact on the economy. And one also now is hoping that with this third wave, which we have seen so many infections, we have had a highly transmissible Delta. There's a significant, and number of the communities, number of the population that actually has been exposed, and therefore there might be some level of immunity. It's just that we never know what that immunity means, how long is it going to last, how much protective it is. But otherwise, really, we feel, if you're looking, for instance, at the proportion, positive, that we're sitting at the moment. Today, I think we're sitting at 12%. Ideally, we want to push it to be below 5%. But it is on the decline. And so we really don't think we are likely to see. Remember, the waves as well are usually, anything between 3 to 4 months. So we're anticipating some, low transmission now for the next 3 months or so. And that's why we feel maybe it is time to relax, the restrictions a bit, but without, going back to not using, but ensuring that we remain actually adhering to the NPIs.
Yeah, we can only pray that we don't get high infection rates in the next wave because it's so unpredictable. So let's talk about suggestions when it comes to the easing of lockdowns. Alan Winde, the Premier of the Western Cape, is suggesting that we ultimately do away with the national state of disaster and let provinces decide whether or not they should roll out certain measures when they see infections increase in their provinces. And the reason he says this should happen is so that the whole country doesn't grind to a halt. It should only be hotspot areas. What do you think of that idea?
Actually, we have debated this, at length, as the MEC, especially because, as we would have seen with this third wave, that the provinces behave differently. And so that does make sense to an extent. But the challenge, really, Shahan, is that when we're looking at provinces within the country, it is very, very difficult to actually have that clear demarcation in that you see people coming in and out of provinces. And so even if we were to engage in a province-directed strategy, whether that really can be kept within the province, I am not sure how successful that would be. So, we are saying when we're looking at the level or the lack thereof of restricting, provincial travel, and therefore whether what then gets done in the Western Cape, is it really going to be kept within the Western Cape? And if it's different in the Eastern Cape, how will that, impact? But, like I say, it's something that we also have engaged in, and we're not sure what is the best strategy to take. So it's something that is worth exploring and looking at all the pros and cons of doing such, of actually approaching it with such a strategy.
And is the MAC satisfied with government's vaccination drive campaigns? Because I'm sure you would have read the News 24 article about 2 of your members saying that government's not doing enough.
Shahan, I was just looking at the daily vaccination numbers in that we really are not getting to where we should be, because we have hardly, lately, been reaching 250, let alone 300,000 vaccinations a day. And that is definitely a serious concern. Now, and the question that we were asking ourselves, one is assuming that it is because it's the numbers that are pitching up for vaccination are not as high as we would want to see that. And what then that means is that we therefore need to have this huge drive of encouraging an increase in the uptake of vaccination. And that needs, every South African to be part thereof. We need the communities to appreciate why it is important for an individual to get vaccinated. We need to send the right messages, and those messages must actually come from the right people. And I think we're now in a stage where the communities themselves, we've got very active civil society in the country. We really need civil society to take this up as well, every other sector, to say how can we actually contribute in encouraging and boosting, vaccination uptake. Because as you are correctly saying, really what we're seeing and the numbers that we're seeing, it is just not what we want. And we really cannot afford to have such. Because I heard the other day, that, government was looking at how can they get to 70% of the population vaccinated, by mid-December. And I'm not sure how we're going to achieve that if we don't ensure that we talk about this. There's proper communication strategies, and we actually increase vaccine acceptance. So there's a lot of work that every South African has got to do.
You've seen like the Deputy President and ministers, etc., going out trying to encourage people. I'm not sure if that's the right thing to actually get people to vaccinate themselves, because it hasn't really helped over the past couple of weeks.
No, it has not, and that's why I'm really now calling out on, civil society, on South Africans to do this. In fact, just the other day, I think it was data on the 6th of September, and these are some of the things that need to go out there into social media, where there was this very, telling pictorial that was coming from Fortescue, just showing the number of cases of COVID and what percentage of those were actually, vaccinated versus those that are not vaccinated, and how many are in ICU and how many deaths, were there. And I think we now need to get a lot more of that information so that the community can see the positive impact of vaccination. Really, we just need to change the messaging that's getting out there so that we can get people to come to vaccination sites and get to be vaccinated.
Yeah, so go there with facts instead of just saying go vaccinate. How do you feel about this trial of children between the ages of 6 months and 17 being trialed in South Africa for the Sinovac?
Yeah, well, yeah, I saw that, and, obviously we're always looking for data, because right now we don't have data on, younger children, especially below 12. I mean, the vaccines that are now, approved are 12 years and up. So whatever, study that can get, up and running, that's going to give us more data, we will more than welcome, obviously. And I know that this one has gone through SAPRA and has been approved. And so it's going to be important, and it's good that it's being done in the country, because then it's going to give us data so that when we get to the level where adults have been vaccinated and we're now looking at opening up, to younger children, 17 and under, then we will have the data available. So I'm more than happy, and we really are all looking forward to see what that data is going to show.
All right. Thank you so much for your time. Always a pleasure talking to you, Professor Koleka Mlisana.